are going to speak about menopausal symptom treatment, and we have three cases, three approaches here. Now, the first approach, if the patient suffer only from vasomotor symptoms, if the patient suffer from vulvovaginal symptoms only. So the first case, if the patient suffer from vasomotor only. The second case, if the patient suffer from vulvovaginal symptoms only, like local symptoms. If the patient suffer from both vasomotor and vulvovaginal symptoms. Also, I'd like to remind you what happened there when you talk about vasomotor symptoms. That mean we have systemic symptoms such as hot flashes, night sweats, and sometimes mood disturbances. Circular systems will be affected. The whole body will be affected. Hot flashes, night sweat, and mood disturbances. When we talk about vasomotor symptoms, here we need like systemic treatment. It's not local treatment. So please remember, with hot flashes, night sweats, and mood disturbances, we need the like oral treatment or like systemic treatment, not like cream or like vaginal cream or something. When we have vulvovaginal symptoms only, here patient may suffer from one of these or all of these, like vaginal dryness, pain with intercourse. Then we have vulvular itching or burning. Okay, again, we are going to discuss three cases here. The first case, menopausal symptoms. We have three type of approach for menopausal symptoms. When you have only vasomotor symptoms, or when you have vulvovaginal symptoms, or when you have both vasomotor and vulvovaginal symptoms. Okay, so as you can see here, when we have all menopausal symptoms treatment, we have vasomotor symptoms only. According to the case, if the symptoms is mild, we have mild symptom, we go with the non-pharmacological approach. Okay, if we have mild symptom, we go with the non-pharmacological approach. What happened if you have moderate to severe symptoms? The situation will be the menopausal hormone therapy, MHT, menopausal hormone therapy. You can see it here, number 2. So with the reference here, number 2, menopausal hormone therapy, and we can ask ourselves: is the menopausal hormone therapy contraindicated? If the answer is no, and we have two approaches there. If the answer is yes, we cannot prescribe hormone therapy, menopausal hormone therapy for the patient. We'll go with the non-hormonal therapy treatment. So we have now approach. If the patient unable to take menopausal hormone therapy, we go with something called non-hormonal therapy. The question: what are the non-hormonal therapy include? The non-hormonal therapy include, as you can see here in number 3, we can highlight it. I prefer to highlight it. We'll go the option for highlight. Non-hormonal therapy include SNRI such as venlafaxine. We have SSRI such as paroxetine. Then we have clonidine, gabapentin, pregabalin. So this is non-hormone therapy for patients from vasomotor symptoms. We need something like systemic effect, oral prescription. So if the patients are from menopausal symptoms related to the vasomotor symptoms, moderate severe symptoms, but the hormone therapy is contraindicated, go with a non-hormonal therapy such as SSRI, SNRI, clonidine, gabapentin, pregabalin. This is one part. What about the second part? Okay, the hormone therapy is not contraindicated. We have to ask ourselves the question here. Let me go to the changing Boiter laser pen. Okay, so what we have here, the hormone therapy is not contraindicated. The hormone therapy is not contraindicated. The question: if the patient undergo the hysterectomy or about to do the hysterectomy, if the answer yes, we no need to. The answer yes, there is a history of hysterectomy or about to remove the uterus by hysterectomy procedure. The situation we will go with the estrogen only. So we go with because there is no risk of endometrial cancer because the patient, the woman already removed the uterus and no risk of endometrial cancer. Okay, if the patient maybe has intact uterus, the uterus is there. In this case, we recommend to use estrogen plus progesterone to oppose the action, to oppose the action of estrogen on the endometrial cells and prevent endometrial cancer. Or we can go with the conjugated estrogen plus bizadophine. So what we have here, we have this reference here with the estrogen only. We go the estrogen only. The estrogen only could be estradiol valerate. The estrogen only could be estradiol valerate. Could be estradiol acetate, intravaginal ring, or systemic estrogen. Here we can prescribe only estrogen. Okay, or with the other option here, the woman has an intact uterus, and we recommend to use a combination between estrogen and progesterone, or conjugated estrogen and bisodoxifene. Okay, so the first case, we discussed the first case for the systemic symptom, vasomotor symptoms, mild non-pharmacological treatment. If the symptom mild, we go with the mild treatment. If they have moderate to severe, we go with ask ourselves a question: is the hormone therapy contraindicated? If the answer yes, go with the non-hormonal therapy such as NR, SSRI, and so on. If the hormone therapy is not contraindicated, we need to ask ourselves: is the hysterectomy there or not? If we have hysterectomy, prescribe only estrogen. If the patient has an intact uterus, we go with a combination treatment between estrogen and progesterone. Okay, the third case here, or the second case, the first case was vasomotor only, the first case. Okay. The second case, the patient has vaso combination, like vasomotor, systemic, and vulvovaginal. So the patient suffers from systemic symptom plus local symptoms. So we need to address both local symptoms and systemic symptom. They said if the situation mild symptoms here, we go with the non-pharmacological approach, and with some vaginal moisturizer and lubricant. So we go with that combination. You can see the mixed therapy to non-pharmacological approach for vasomotor, and for vaginal moisturizer and lubricant for vulvovaginal. If the situation mild to severe, we need to ask ourselves again this question: does the menopausal hormone therapy contraindicated or not? If the answer yes, we'll go with the non-hormonal therapy. This is non-hormonal therapy plus vaginal moisturizer. So what we have here, we have two approach. We have two cases here, because the situation will have systemic and local effect. Our approach will be systemic and local effect. Non-hormonal therapy, oral, and vaginal moisturizer for local. If the patient has no contraindication for use a hormone, there is no contraindication to use hormone therapy, we need to ask ourselves: is the hysterectomy take place or not? If the hysterectomy take place, okay, there is no risk of endometrial cancer, we go with the estrogen only. If the patient, the woman, has the intact uterus, we go with a combination treatment between estrogen and progesterone. Okay, the last case here, if the patient has vulvovaginal symptoms only, so we can't speak here about local symptoms. Only vulvovaginal symptoms only. How to treat the menopausal symptoms here? The situation for vulvovaginal symptoms, if the situation is mild symptoms, go the vaginal moisturizer and lubricants. If the situation mild to severe, we start using vaginal estrogen preparation, and we can use low estrogen systemic exposure, and we can use osmifen or like progesterone. So we have three type of approach. Mild symptoms, we go with the vaginal moisturizer or lubricant. Moderate to severe, we go the vaginal estrogen preparation. We use low estrogen systemic effect, or we use osmifen and progesterone. So we have several approach to the patient. Again, I would like to remind you what that mean when you say vulvovaginal symptoms only. Go to the previous slide. Vulvovaginal, you can see it's like local effect. We have vaginal dryness, pain with intercourse, vulvar itching or burning. So we have local symptoms here. Okay. So this for this reason we go the local treatment. Okay, what that mean when we talk about non-pharmacological treatment for mild symptoms for patients from menopausal symptoms? Non-pharmacological could be dress and layer. Try to the dress and layer that allow to remove the clothing to adjust temperature, maintain cool environment, stress management. Sometimes we have mood disturbances. Identify and avoid triggers such as spicy food, alcohol, smoking, caffeine, and so on.